All right, hi everybody, I'm Dr. Sexton, and I'm coming back to you to talk today about specifically addressing low back pain. This is a very common problem that we see in my medical office, and again, we're always going to be approaching these kinds of problems from my three-pronged approach. We got to take care of the inflammation that's going on that's contributing to your back pain, and we want to use something like naproxen or ibuprofen to deal with these things. Talk to your doctor about what's going to be best for you, but remember not to substitute just pain medicines for anti-inflammatories. Today what we're going to be talking largely about are the effects of this and how to do stretching that are specific for the low back problems, and then we'll also address some of the contributors. But this is low back pain and try to address all of these issues. I mentioned just a second ago that we're going to be talking about low back pain. Now most often whenever people get low back pain, the thing that they're worried about is that their spine has been injured and that they're going to be damaging the spinal cord and they're going to need surgery, and that's the worst thing in the world. That's true, that's definitely something to be worried about, but more often than not, the thing that's causing people's acute pain is not damage to the spinal cord or to the discs. Rather, what they're getting is a little bit of back pain that starts their body off into a cycle of spasms that happens. And the spasms that we see most often are in the piriformis muscle in the IT band. Now the piriformis muscle is a triangle or pyramid-shaped muscle that starts in the lower back and goes into the upper butt cheek and goes all the way down into your lower thigh. And what that muscle is doing for people is as they are standing up with their posture and leaning forward trying to protect themselves from getting the worst back pain that they've ever had, what needs to happen is a muscle must flex along the back side of this to keep them from falling forward onto their face. And so the muscle gets charged with that responsibility as the piriformis muscle. The problem is that the muscle actually wasn't made for doing that. It actually wasn't made to do anything in humans. And it's left over from when we were on four legs and jumping up into trees and relaxing all day long. So this muscle that was made to work ideally at a 45-degree angle is now being asked to do something just outside of its comfort range. And so that muscle then tends to start breaking down over the course of the day and causes people to get more back pain throughout the day and periodically get spasms. And a spasm of this muscle is going to pull the vertebrae a little bit closer together or pull the vertebrae closer to the pelvis and perhaps catch that, causing a sharp pain whenever they move in the wrong direction. And so what we're going to try and do is take down the inflammation in the back as well as this muscle with our ibuprofen or naproxen. We're going to try and stretch this muscle out so that it's not so inclined to get these kinds of spasms. And then we're going to work on your posture such that that is not so much of a contributor to getting this kind of pain or spasm going on. So I'm going to teach you now how to stretch that muscle. So right now we're going to be talking about the piriformis stretch. And this is a little bit of an awkward muscle to stretch because it requires us changing the angle of our legs. It's not simply like stretching your hamstrings. And so if you are a yoga connoisseur, you're probably going to remember doing something called a pigeon pose in the yoga. But I don't find this an ideal stretch to get this muscle out because it requires you to focus too much on balancing and it requires you to focus too much on the posture of your chest and back. So I like to simplify it by using a bed or a table. You can find any flat structure that you want around your house that comes up somewhere between your knee and your hip. And since I've gotten casual here to do a little bit of stretching, I'm going to show you how I do this on my office. Now that I've gotten casually dressed here and we're going to be about ready to stretch, I'm going to show you how to do this. But again, rather than doing the pigeon pose to do this, I'm going to do what I call the modified pigeon pose, and I use a bed to do this. Find anything that comes up between your knee and your hip in order to do this stretch, and come up flush against it. And the goal is going to be to get your leg up on this where your thigh is going to come out at a 90-degree angle from your body, and your knee is going to bend at a 90-degree angle like this. Those angles are important in doing it, and that's what's so difficult whenever you actually use the pigeon pose. Then I bend down at the knee as well as at my hip in order to put all of the bending right in my hip socket here. And I'm going to try and touch my chest to my calf. You don't have to get all the way down there. You're simply trying to cause a little bit of mild pain in there. This is good pain as opposed to bad pain. You want to try and feel that so that you're pushing yourself a little bit farther than feels comfortable. And as you feel that discomfort, what I want you to do is I want you to think about the muscle that I've drawn up there, and I want you to think about that muscle drooping down and relaxing like a willow sagging in the breeze. Just think about that drooping down as you exhale. And I'll hold this for about 30 seconds. Each time I exhale, I always want to be thinking about that drooping down. And by relaxing it in that way, you're completing a neural circuit from your brain that is getting your brain involved with the relaxed posture of this muscle. After you've done this for about 30 seconds, I'd like you to get up off of the bed and put your hands around your hips, even with your thumbs on your butt cheeks, so you can decide whether you've actually relaxed that muscle. If you've gotten it relaxed, you can imagine yourself doing a little microscopic hula hoop, and that relaxed muscle should allow your body to rotate around this without too much jerking. If the muscle's too tight, you might find your pelvis jerking around like a clock ticking around the second. Okay, so we're going to repeat this on the opposite side. You just want to get the legs out at a 90-degree angle, bending at the other knee, bending at the hip, and trying to get a little bit of mild pain as you do this. Again, thinking about that muscle drooping down and sagging as you exhale. Do these 3 sets on each side.